Hey everyone, Ali here. So you want to know how to maximize your sale price when you're selling your practice. Well, there's a couple of ways of doing it. Obviously, increasing your revenues always helps. But if you're within 1, 2, or 3 years of selling your practice, then one of the best ways is to minimize your expenses. Remember, a lot of times when we talk about practice valuations or when banks look at practice valuations, they speak in generalities as a percentage of your gross revenues. But when they're doing their underwriting and analyzing it at the detailed level, they're looking at it as a multiple of your profit. Okay, they're two very different things. Here's why, and I'll give you an example to drive this home. $1 million practice that does $200,000 of profit is going to be worth less than $1 million practice that does $500,000 of profit. So if you said, a typical practice goes for, I'll just make up a number, 75% of gross revenues, then those two practices would be valued exactly the same because they gross $1 million. But the reality is that that's not how practices are evaluated. They're evaluated on their profits. So a typical practice does anywhere from 1.5 to 2.5 times their profit in terms of valuation, depending on how new the equipment is, the location, new patient counts, and other things. So the more you can save on expenses, the more profitable your practice is, which then means that the higher the valuation. So within a couple of years before you sell your practice, ideally 12 to 24 months before, you want to start cutting expenses that do not affect your top line revenues. So I'm not saying cut your marketing, because your marketing may be driving new patients, and so that's more valuable. I'm not saying, don't buy, a CAD cam, if that helps you increase your profits. Don't not buy an intraoral camera if it increases your new patient, or your case acceptance, I should say. Do those things that invest in you making more money with top line revenues. But the expenses that you can cut are some of your more personal type expenses, vacations, maybe your car, other things like those that really add up, dinners and other things that you run through the office because it's a good play from a tax perspective for all these years. The last couple of years may harm you. To give you an example, if you save, let's say, $50,000 in expenses in 1 year, which is not as hard as it seems when you start to really look at how many personal expenses you might be running through the office. If you save that much, that could mean an extra, let's say, roughly $100,000 in value to you with regard to the valuation of the practice. So that's sizable money. That's absolutely sizable money. And especially if you start thinking about how much that 100,000 could grow in the next 10, 15, 20, 25 years while you're in retirement, it really becomes a sizable number. So in addition to increasing your top line revenues the last few years, don't take your foot off the pedal. Make sure your revenues are strong. The best way to increase the value of your office in the last 24 months is to make sure you're starting to cut expenses that don't impact your top line revenues. Okay, if they don't impact your top line revenues. Now, remember, don't do anything that does that. Don't cut any expenses that increase your risks. Don't cut your insurance payments. Don't cut your HR software if you've got one. Don't do those kinds of things, but focus on the expenses that are a little bit more personal. All right. If you have any questions, don't hesitate to call me.